name's Peter Borum and I'm a nuclear medicine technologist for X-ray and imaging. Nuclear medicine involves the use of radioactive materials, radioactive substances to diagnose and treat disease. Often patients referred from the GP will be referred for an exercise stress test alone, and oftentimes that will be an equivocal test, which means the results may be false positive, which means it's a positive stress test and the GP's none the wiser as to whether that's significant or not. The stress test is a good screening test, but if it does turn up something abnormal, then the patient would need to go on to have an MPS scan, I think, to determine whether there's anything significant there. Patients that have developed shortness of breath on exertion, sort of out of the blue with no lung cause for that, they may develop some atypical chest pain. The beauty of the test is if they have a normal myocardial perfusion scan, it gives them a clean bill of health for the next 5 years. There's a very low likelihood of them actually having any significant coronary event. X-ray and imaging have state-of-the-art equipment for nuclear imaging. It's a SPECT CT hybrid imaging camera, which means we can do the nuclear imaging and get an idea of the physiological function of the organ, but then we can do immediately after that images a CT scan, which adds the anatomical detail to the images and provides a much more accurate diagnosis. So what we have here is a nuclear bone scan done on a patient that's referred to us with back pain. We do a SPECT scan, which gives us these additional image information, three-dimensional pictures of the lower back. We then do a CT scan in the machine at the same time, which is displayed down below, and we can see that this area here is relating to a facet joint. You can see now that the nuclear image is superimposed directly on top of that area there, so the facet joint is highlighted, and that would be an area where they would target with a cortisone injection under CT guidance later on to try and relieve the patient's pain. Medicare rebatable services are bulk billed at X-ray and imaging, so there's no out-of-pocket expenses for the patient.